Langley Lodge is a nursing home in Westcliff. We are registered for 29 beds and we tend to take in a lot of palliative care patients, end of life care, palliative, fast track, normally from the hospital, but we also take quite a lot from the hospice as well, so we have a lot of complex care needs here. Obviously since COVID, we shut our doors to keep them safe, and then everything had to be done remotely, so it was about learning about what we can do to continue to ensure that they got the care that they were having before and that their needs were met and that the families felt reassured that we were able to continue to support them. Everything became sort of remote and new, sort of the new technology kind of kicked in, and it was very strange at first because it took a lot of getting used to, especially for the service users, because seeing somebody on a screen, you know, it was a bit sort of like, what's this, because this hasn't happened before, but it's become kind of regular, it's become the new norm, should we say now, and they're kind of getting used to it, so yeah, it's definitely worked. Yeah, before we would have phlebotomists come in and they would do regular blood testing and things like that, but the nurses have taken that on board, so that's an additional role that they've taken on, to prevent an extra person coming in the building, so we just kept foot traffic in the building as minimal as we could. We've had more contact with the doctors because, again, rather than them having to travel out to us to see our patients, it can be done by video link, and it takes up 5 minutes, which can be done in between a clinic, whereas before it would have to be facilitated in and out of afternoon visits, so it would take a lot longer for the GP, and then when they did come, you could probably only see one because they had others to go to. But I think because it's done via video link now, as soon as they've got 5 minutes, they can just phone you up. Can I see this patient, or can we discuss what's going on? So I think the frequency of doctors has definitely been a positive for us.